And going from North America to Europe, we have someone who knows a lot about innovation. Not only does he lead innovation at Mercedes-Benz, but he also has one of the coolest background filters in Europe, if not the world. We have Michael Vormittag, who heads up innovation at Mercedes. First, Michael, tell us what class Mercedes is that's that you're sitting in right now.
So that is the brand new EQS, our electric S-Class flagship car. And whoever is interested, those backgrounds are now available on our website to download for free.
That's fantastic. So, just incredible background. By the way, our executive director who loves Mercedes, when you sent it to me when we were chatting earlier this month, I did forward it to him, and he's very grateful. So thank you for that.
Okay. That's also a more unique one. So this is downloadable. What I sent to you is more unique.
So look, first of all, thank you for joining us. I know it's late where you are right now in Germany, but if you could, you're obviously coming from a non-healthcare background, but one of the things that we always do at HitLab and at Columbia is we're constantly benchmarking. We're looking for what's happening in other industries and how to use those in healthcare. And this has never been more important than now. We're trying to find better ways to not only create vaccines, but distribute them. We're trying to find better ways to provide healthcare virtually, whether it's telemedicine, electronic health records, whether it's remote patient monitoring, AI. What are you guys doing at Mercedes? Tell us about how Mercedes-Benz manages innovation, and particularly given the fact that now automobiles are moving into healthcare, how you guys handle partnerships, since we have a lot of people all over the world online right now listening, watching you, and we'll see this on YouTube later, and trying to understand how to partner with Mercedes-Benz. But how do you guys manage that?
Well, I mean, that's good question, and I think there's also some kind of parallel to healthcare and generally, because I mean, we as a car company, we are traditionally very strong in internal research and development. Right, so we build our cars, we build our engines, so we do have a strong innovation in-house capability, and also partnerships actually has been in the traditional space something we've been doing forever, because the car is eventually produced by bringing different pieces together just in time to the assembly line and then manufacturing the car. But what I'm more focusing on, and I think what is also interesting for this group is the less traditional innovation, the digital fields, the things where we as the traditional OEM big car company are not naturally born with. And also a partnership play a big role in that, right? So the question is, how do we do that in the digital fields? So what we do in Mercedes is we have a variety of professionalized teams which take care of those new fields of, let's say, non-traditional partners for us. Those can be on the very early side kind of an engagement. So for example, I have in my team, I have a startup program based in Tel Aviv, where we sit in Tel Aviv, we scout the market, we have cohorts basically of startups, which we then bring to our business units overseas, in Europe, also in the States. And we have a couple of those initiatives, right? So we have them centralized in the headquarters. We have them in satellites, such as what I described in Tel Aviv. We have it in markets like in Korea, in China, so in different satellites, to be kind of those touch points in the ecosystems. But we also do have teams on the other side, which are sitting in headquarters, which basically take the longer lasting partnerships into consideration. So once you have this first, let's say, proof of concepts, pilots done, then of course, if something gets, for example, built in a car, and if we talk later about healthcare and the car industry, I mean, once you have a product which is embedded in, for example, what I'm sitting right here, then of course, it's not an early stage engagement, right? So this takes a while. A car takes a while to produce. So then we have teams handling this. And we have also, on top of that, we have an investment team also, which supports basically the partnership roles if investment is the right vehicle of choice. So that's maybe a quick overview on how we do it.
No, that's a fantastic overview, and thank you for doing that. And again, if you're in the audience, please do line up any questions or any kind of questions you'd like us to ask Michael as well. But I think one of the things that you and I talked about when we were talking beforehand was around this idea that the car and healthcare are merging. I mean, we're seeing this now with Apple announcing the launch of the Apple Car, and we know that there are already massive into healthcare with the Apple Watch, and they have more employees stationed within 10 miles of the FDA than any other company in the world. Tell us a little bit about Mercedes, what Mercedes is thinking about for healthcare in the future, and again, how some of the folks that are listening here today, some of the leading digital health companies, the venture firms, life science companies, et cetera, can and should be thinking about healthcare and partnerships and innovation with Mercedes.
Yeah. So there's a couple of things, right? So first of all, I think jointly the industry came to the understanding, especially in the premium segments, that the car is or will be another space of living, right? So I mean, especially moving to more autonomous and more automated driving, then of course you sit there. It's kind of there's other stuff you can do besides driving, and of course also the machines get more intelligent, so which enables you to do more things, not only moving from A to B. And having kind of a luxurious approach, of course, also our vision is always not only get people from A to B, but being really like a premium experience, obviously, right? And so what we do now already, if you purchase those features, of course, there is already some health features implemented in the current vehicles, right? So we have, for example, an energizing coach feature, which is implemented. And of course, that's the start, right? So that doesn't necessarily be the end of the journey. But then we try to kind of help the driver with massage, relaxing sounds, with also fragrances. I mean, this is not really health, I guess, to the extent you're doing it, but it's kind of the first steps in the direction of kind of bringing at least some ease to the customer and making the space more livable in a way, the car. But we're definitely looking more into this. So for example, I currently have a challenge running with a European, with the European Innovation Council. That's one of the organs of the European Union, which is investing in SMEs, generally speaking. And we do have a challenge for different SMEs, which we are looking for. And one of the basically verticals we have there is also healthcare, right? So we are actively currently looking for companies which are either in the space of mental health, mindfulness, or also monitoring with sensors basically of health in the car. So to understand the driver, both his physical condition, but also kind of how he is behaving in the car, also for safety reasons, obviously. And then also into different camera technology, for example, to be able to, with cameras, monitor different, let's say, vitality features of the car, heart rate of the driver, heart rates, and stuff like this. So this is something I have currently out there, and I'm looking for companies. So if there's any companies for this, we can also connect later, and I can bring you together with the people who are actually looking into this. So this is very, very recent, and we use, for example, in this case, the EIC as an instrument kind of to reach out to European companies in this, but theoretically not necessarily limited to Europe, obviously.
No, obviously not. No, that's fantastic. So if you can send us a link to that, Michael, to all the attendees,
absolutely, yeah.
We will shoot that out to you all later. We do follow-up emails after this. I just to say thank you for attending, asking for feedback and that kind of stuff. But again, we have about 3 minutes left, so kind of one more question here, I think would be great to answer. I think one of the audience members is asking about remote patient monitoring in passenger cars, traveling in cars, etc. Someone else is asking about exercise in a car. Maybe not. Maybe if you're not driving, or maybe if you have a driverless car. I don't know. But tell us about some of the things that maybe that you can. Again, nothing confidential that come to mind, or that that Mercedes might be thinking about for healthcare in the car, whether it's actually.
I mean, one thing which we are piloting, I don't know what's exactly the status, if it's already like really live or only a pilot, but I can definitely talk about it, is for example, in our trucking business, is a predictive Lifeguard feature. So vision there is to prevent accidents based on a driver having a stroke or fainting while driving. Because of course, if you have the big machine and you're running on a not smaller car, it's not a good thing, and a lot of accidents actually happen on this. And so we have a pilot actually running on this on measuring basically the heart rate of the driver to make sure that he's basically still alive and well while driving a truck. And so this is one example. And of course, if you look at this, right, so I think nowadays, so I haven't been part of that project, right, so I can't give you the details, but nowadays it's probably still done with physical sensors attached to him in the pilot phase. But I think the vision definitely is to do this kind of via camera or via some, let's say, more distanced sensing, and then this is very powerful on the one hand for the health of our truck driver, obviously, but then also for potential traffic accidents. So just one example, maybe.
Yeah, no, that's fantastic. And again, we've got about one more minute now. So any final thoughts about innovation, the future of innovation, and general processes that you think healthcare leaders that are listening to this program should adopt in hospitals, life science companies that are running clinical trials and things like that?
Yeah. So I think a very general theme, I think, is super important. I see in conversations with, let's say, smaller companies, or not only smaller companies, but let's say generally partnerships, is that many transactions or many discussions are way too transactional, right? So people want to sell me, and that happens all over time. So if you have something for what I just asked before, just don't try to sell me, right? It's not about just selling a solution. It's actually about understanding the partner and really taking the time to understand what's in for me and what's in for you, right? So to really come to terms and see it as a partnership, because especially in automotive, but likewise in health, it's never a for tomorrow thing. It's something which requires a more longer lasting partnership. So the cycles are longer, and you need to trust each other. You need to understand what the other party is doing, and then you're going to be successful.
Incredible. Well, thank you very much. A virtual round of applause from all of the gallery. Thank you, Michael, for joining us today.
It was a pleasure. Take care, guys, and thanks for inviting me.